So hello everyone and welcome to this webinar event where we'll be discussing the Melbourne and Sydney results for the Lancet Global Health series on urban design, transport and health. Apologies for our slightly late start because of some technical challenges. I'm Melanie Lowe, Research Fellow at the Melbourne Centre for Cities at the University of Melbourne, and I'm also an executive member of the Global Healthy and Sustainable City Indicators collaboration, which has published the study we'll be discussing today. And this event is hosted by our collaboration and RMIT University's Healthy Livable Cities Lab in partnership with the Melbourne Centre for Cities, the Mary MacKillop Institute for Health Research at the Australian Catholic University and the School of Public Health, University of Technology, Sydney. I want to acknowledge the traditional owners of this unceded land who have lived and loved this country for thousands of years. I acknowledge the Wurundjeri people of the Kulin Nation on whose country I stand today, and we also acknowledge the traditional owners of the country from which participants may be joining us today. I acknowledge and pay our respects to their elders past and present, who are the safe keepers and caretakers of the oldest living culture on the planet. We particularly acknowledge the traditional owners of the many lands that make up Melbourne and Sydney, which we'll be discussing today, and also extend that respect to Aboriginal people present. So some of you may have just attended the global launch of our 5-paper series, which involved assessing the health and sustainability of 25 cities across 19 countries. And we used policy and spatial indicators of urban design and transport features. Sydney and Melbourne were 2 of the cities that we included. We also studied Adelaide, and we'll be having a separate event later this year in Adelaide to discuss results for that city. Here today, our purpose is to take a more detailed look at the Melbourne and Sydney results and implications for ensuring that our 2 largest cities are as healthy and sustainable as possible. So just a brief overview of what our session will involve. You'll hear from some of the lead researchers as well as a panel of experts who will discuss the implications of the findings. So we'll have a brief presentation on the indicator results by Carl Higgs, followed by Professor Billie Giles-Corti to discuss where to next and introduce and facilitate our panel. We'll then have the opportunity for some audience Q&A led by Dr Klaus Giebel before we wrap up. And I encourage you to post questions for the presenters and panellists at any time using the Q&A button on your screen. And we will address those questions at the end when we get to the Q&A. So it's my pleasure now to introduce Carl Higgs, who has led the development of research reports for each city in this study. Carl is a research data scientist and PhD student at the Healthy Livable Cities Lab at RMIT University. Thank you, Carl.
Thank you, Melanie. And I'll just confirm you can see my slides here. Morning. In this presentation, I'll be going through the results for Melbourne and Sydney arising from our recent Lancet Global Health series on urban design, transport and health. Accompanying the publication of the series, we've produced city reports and scorecard infographics, which distill the key findings for each city and provide comparisons with other cities in the international study. These can be downloaded from the newly launched Global Observatory of Healthy and Sustainable Cities at healthysustainablecities.org. A total of 46 reports are available for the 25 cities across 16 languages to help ensure the study results are accessible for local audiences. And this includes the reports for Melbourne and Sydney, which we'll now focus on to compare these cities' policy and indicator results with each other and with other internationally diverse cities included in the study. As Southeast Australian coastal port cities developed through the 19th to 21st centuries, having temperate climate and experiencing the challenges of rapid and sprawling population growth, Melbourne and Sydney share a lot in common, and this is noticeable in these cities' results. We evaluated the percentage of population with access to a range of amenities to support healthy, active lifestyles. This allowed us to make comparisons for each city against global benchmarks, and some of the results I'll present compare the city accessibility results for Melbourne and Sydney against the median, or 50th percentile, of all 25 cities, represented as a large black dot with a line through it indicating the usual range where most cities' results lie. And throughout this presentation, I've used Fabio Cremeri's scientific colour mapping colour scale, where an ocean blue indicates low results, an autumnal green average, and a peachy pink high. I know some people like red, amber and green, but apparently this one's a bit more colourblind friendly. We can see that both Melbourne and Sydney have established transportation networks with coverage comparable to most other cities in our international study, with more than 90% of residents having access to a stop or station within 500 metres, and this is approximately equivalent to a 5-minute walk. However, this particular metric doesn't consider the connectivity nor the service quality of stops. Fewer than 50% of Melbourne's residents were estimated to have access to public transport stops with a usual daytime weekday service frequency of 20 minutes or better. This proportion was slightly higher for Sydney residents. However, some of the cities in our study had more than 90% of the urban population living near well-serviced public transport stops, specifically Sao Paulo, Lisbon, and Bern. Access to public open space, including large public open space, was better for Melbourne and Sydney than most other cities included in our study, but concerningly, fresh food access was in the lowest quartile, with fewer than 25% of population in either city within a 500-metre walk. Mapping our indicators allowed us to show spatial inequities in access to urban design and transport features important for health and sustainability. The fewer than 50% of Melbourne's population with access to regularly serviced public transport were particularly concentrated closer to the city, while for Sydney, which had a slightly higher result for this statistic, access appears slightly better distributed across the city. While only approximately 60% of residents in either city have nearby access to large public open space, this access was relatively evenly spread across both cities. In this study, we also evaluated the availability and quality of policies needed to create healthy and sustainable cities. In terms of urban and transport policies needed to transport policies supporting health and sustainability, the presence and quality in both Melbourne and Sydney was above average compared with other cities. Melbourne's ratings for these metrics were slightly higher than Sydney's, having the equal second highest score for policy presence of the 25 included cities, suggesting it has a relatively comprehensive policy framework. Looking at overarching city planning requirements that support city health and sustainability, both cities' urban and transport policies detailed specific health-focused actions. However, health impact assessment requirements were not identified in urban nor transport policy and legislation for either city. Sydney in particular did not appear to have air pollution policies related to land use planning. We also looked specifically at the quality of policies for public transport and public open space access, as well as walkability, which is shown here. And we found that there were some policy areas that could be improved. While Melbourne had policies supporting walkable neighbourhoods, some did not include measurable targets to guide implementation, for example, with regard to parking restrictions for discouraging car use, provision of pedestrian infrastructure, and walking and cycling participation targets. Housing density requirements were found to be too low to be consistent with health evidence, that is, too low to support neighbourhood walkability. For Sydney, housing density targets were mixed in terms of their alignment with health evidence. We did not find any policies detailing minimum requirements for street connectivity, which is an important determinant of neighbourhood walkability. But further, there were no measurable targets for parking restrictions and cycling and pedestrian infrastructure. These are all policy areas that could be strengthened. In terms of public transport policy, Sydney rated highly. However, Melbourne lacked some measurable targets and was not always clear in terms of consistency with evidence for health benefits. Both cities had clear and measurable targets specifying minimum requirements for access to public open space, a metric which we saw both cities scored relatively highly on. We also evaluated the percentage of population living in neighbourhoods meeting minimum thresholds for densities associated with achieving physical activity targets, such as the World Health Organization's goal of a 15% reduction in physical inactivity by achieving at least 150 minutes of total walking per week. Fewer than 20% of Melbourne's population were estimated to live in neighbourhoods with sufficient density to achieve this WHO goal, and for Sydney, approximately 50%. On the other hand, a greater proportion of Melbourne's population meets minimum recommended thresholds for street connectivity than for Sydney. Yet in both cases, fewer than 25% of the population live in neighbourhoods meeting this minimum standard. Broadly speaking, population density and street intersection density were both concentrated towards the historic urban centres. of the two cities, with sprawling urban expanses having lower populations and reduced connectivity. And as such, in terms of average neighbourhood walkability as a function of population density, street connectivity, and proximity to daily living amenities, including fresh food, the Australian cities share more in common with fellow settler colonial cities such as Seattle, Phoenix, Baltimore, and Auckland than more densely urbanised Asian or European cities such as Chennai or Barcelona. In addition to reports for the 25 cities, we've also produced scorecard infographics, which summarise key results from the study for each city. These can be downloaded along with the indicator reports from the Global Observatory of Healthy and Sustainable Cities at healthysustainableCities.org. And I'd like to acknowledge in that my colleagues on the study executive, and in the context of this presentation, and our local collaborators on the collation and dissemination of results for Australian cities. And the local experts, including Dr. Klaus Gerbel, who joins us today, who assisted with applying our methods to the diverse cities studied internationally. I'll now hand over the presentation to distinguished Professor Billie Giles-Corti. Thank you.
So I'm going to talk you through the what next. We in the series that we published, we considered what next as a result of publishing the results and a call to action to create healthy and sustainable cities. And I want to talk you through those results so you can see. I've tried to make them localize them for the Melbourne and Australian sort of context. So since we published our first series in 2016 on series on urban design, transport and health, what we've seen is that the evidence is growing and it's growing stronger. There's many more longitudinal studies now, which is the gold standard in research, in health research, showing that the way we design cities has an impact on chronic disease outcomes for city dwellers. But of course, cities are the major generator of emissions, CO2 emissions, and they're now being directly affected by climate change, as we're seeing in recent years, even in Australian cities. And so the urgency for integrated city planning to mitigate and adapt to climate change has become palpable. We need to act, and we need to act soon. We're also seeing that during the pandemic that city planning has really had a big impact on the quality of life of people during a pandemic. We saw, for example, that people living in amenity-rich areas where there's shop services and public open space, they were fortunate during the pandemic because they had all the amenities they need for daily living nearby. But of course, we've seen globally and also in Australia, there's an equitable access to these types of amenity-rich areas. And when we were asked to work from home and then restrictions outside the home became into force, we saw that people who were living in higher density inner city developments with insufficient space or poorly designed space migrated to the suburbs and the regions, and that's put a lot of pressure on housing affordability in those areas and also pressure on amenities in those regions. There were some positive things that we saw. I think telecommuting from a health point of view has got lots of benefits, meaning people can live and work in their local community, and that was beneficial. It's something that's been wanting to achieve, but suddenly it could be done. We saw road space allocated, more space allocated to walking, cycling, commerce and recreation. And we saw a proliferation in Melbourne and probably in Sydney too of pop-up cycle lanes, which meant that people could cycle more and cycle more safely, particularly when people were a bit reluctant to get back onto public transport. And I think globally what we've seen, which is a really fantastic initiative, is a commitment to build back better. For example, the C40, which is the network of megacity mayors, have committed to build back better, to create 15-minute cities. And this is not inconsistent with the idea that we have in Melbourne, which is a 20-minute neighbourhood, or the 15-minute idea in Sydney. So we're on target in terms of achieving it. The question is, how do we go about achieving that? And that's an important question, actually, because what the series addresses is that we argued in the first series, which we published in 2016, just how important it was to create more compact cities that were walkable, that would encourage healthy and active lifestyles. But what we wanted to do in the second series was say, well, how do we optimise compact cities, the 15-minute cities, to not only protect human health, but also to consider ecosystem health and planetary health? And to do that, what we've done is in our series, we've created now a new comprehensive framework about the way city planning decisions affect health and wellbeing for humans, but also ecosystem health and planetary health. And then what I want to do here is just talk a little briefly about some of the where to next areas that we think for planning, which some of which have started to already be implemented in Australia, but really wanted to emphasise just how important these are. Now, we've shown through the pandemic just how important the quality of our housing is for a good outcome. And for a compact city, we do need to have high density housing. But clearly what's important is it's density done well, density with standards that will protect the health and wellbeing of people who live in those cities, recognising that there may be a crisis, as we've seen with the pandemic, where people will need to work from home and are restricted. So how can we embed housing standards into high density housing that ensures health and well-being for the residents of those people? We've emphasised in the second series the importance of protecting the ecosystem, which is under threat on many levels. And in particular, we've seen that there's been destruction of biodiversity, which is rapidly increasing as we urbanise our cities globally. What we've suggested and recommended that it's important that we incorporate into our planning standards for new development biodiversity sensitive design, which will protect biodiversity in our new developments and in existing areas. And we've also recommended, as a result of that, upstream we need to be focused on nature-based solutions that we can use to protect our cities, to protect biodiversity, but also to tackle and adapt to climate change, to use as a flood mitigation strategy and to avoid disaster mitigation. We need to cool our suburbs by using nature-based solutions, greening our suburbs to mitigate heat island effect. And that's important because that will cool urban environments and reduce energy emissions, which are contributing to climate change. Now, we've emphasised the importance of air pollution in the second series. It's the fourth largest risk factor for global mortality, and there's no safe level of exposure for air pollution. And that's important when we're thinking about where we're locating high density housing, but it's also important about shifting away from our car-centric planning, which has been such a focus of Australian cities and American cities since the Second World War. We need urban planning that really does support sustainable mobility so we can achieve the 15 to 20-minute neighbourhood to encourage walking, cycling and public transport use. But also we need policies that reduce the demand for driving, as Carl showed, that there's very few standards around, measurable standards about reducing parking, for example. But we need to start to think about how can we reduce the demand for driving. Better public transport is one way of doing that, but also restricting where and at what speed people are permitted to drive. This is certainly something happening in Europe more to protect people from air pollution. And we also need to be thinking about the cost and availability of parking. Now, to achieve all this is not easy, and it does require integrated governance, and that's horizontal across all these different urban systems, all the different departments that help deliver the city, so across government, but also vertical integration of different levels of government, working with the private sector and the community. And we've emphasised in the second series the importance of distributed, that what we've identified, there are incredible inequities in our cities in terms of who has access to health supportive amenities and health supportive environments. And so we've added in as our 11th D, we used to have 8 Ds, we've gone to 11 Ds now for urban and transport interventions, and we've included these to be distributed so that people have equal access to health supportive amenities. Now, our series includes a call to action because this is a whole of society approach that's need to actually address these issues. And one of the things that is relevant to Australia as much as anywhere else, we need to benchmark and monitor our progress in achieving healthy and sustainable cities, but do so by using policy indicators to ask ourselves the question in all of our jurisdictions, do we have the policies in place to deliver these healthy cities? But also spatial indicators to show how well we're doing, to show that the built environment, the experience, the lived experience of people living in cities, so we can highlight where we are to intervene, both in new areas but also in established areas. And what we've recommended is people use the tools that we've created for the series because they are all open source and available, but that we expand these tools to include additional indicators of traffic exposure, heat island effects, a green canopy. All of these things could be added as spatial indicators which will create healthy and sustainable cities. We've emphasised the importance of transforming urban governance, and we talk about this a lot in the Australian context, but it's easy to say about integrated governance of cities, but it's very hard to achieve. And we've argued that we need to have two ways to do this: the horizontal across different levels of government, all people working together for the same outcome. And we need vertical integration as well between different levels of government with the private sector and the community. We've highlighted the need to strengthen our policy frameworks. I think we've started to do that in the last few years in Australia. And I know Brent will talk about this in terms of the work that has been done by the Victorian Planning Authority. But we want to strengthen policy frameworks to achieve the cities that we know that we need and we want. And we've suggested that we incorporate the 11 Ds, not the 8 Ds that we used to have in our framework, but the 11 Ds to ensure that we do have the frameworks that will produce health and well-being and more protect the ecosystem and to improve planetary health. We've argued the need to use evidence, and importantly, what's critical here is to monitor implementation. Policy is only as good as its implementation, and so we need to set up these policy and spatial indicators to monitor how well we're doing, not to give ourselves a hard time when we're not doing it well, but actually to be serious about monitoring how well we are doing and making sure that we can try and intervene when we see early warning systems that things are not going as well as we'd like. Now, we know that we want evidence-informed policy, and it's great to see that that's more happening in Australia than we've ever seen before. But if we want to do that as researchers, we need to create policy and practice relevant evidence. And that's only possible by academics, policymakers and practitioners working together in partnership to co-design research. And funders need to fund this research. I left on my objective for the funders, but the funders are really important here to fund this sort of research that brings together policymakers, academics and practitioners to co-design research that can influence a policy in Australia. And finally, we've demonstrated through this global study the relevance and availability of open data. And what we've shown is that it's often as reliable and even sometimes more reliable than what's available through routinely collected data. And that's because people are doing this all the time. It's the community of open scientists that are actually going out and collecting this data, and it's being updated all the time. We need to use and create more open data. We encourage citizens to jump on board to this call to action and for civil society to be promoting the use of it. We'd like to see citizen science programs established, and we want to create the 1,000 Cities Challenge where more cities use our indicators, use our tools to create policy and spatial indicators that are comparable so we can benchmark and monitor more cities and to see whether we can move to a healthier and more sustainable future. Now, on that note, I'm going to introduce our panel because we want to now stop talking about the results, but to get some feedback from panelists who can help unpack the results and talk to us about how well we're doing, what their reactions to the series, but also to tell us about what they're doing that can help to achieve this agenda. So I'm going to introduce them all. First of all, I'd like to introduce Dr Gillian Sparkes. She's the Victoria's Commissioner for the Environment, and she was recognised in 2020 as the Victoria's top 50 public sector women in Victoria. So welcome to Gillian. Professor Tony Capon, he directs the Monash Sustainable Development Institute and chairs the Planetary Health and is the chair of Planetary Health at the School of Public Health and Preventive Medicine at Monash University. And he's also on the International Advisory Board for the Lancet Planetary Health, a journal in this important area. Brent McLean is the director at the Victorian Planning Authority, and he's leading a program of place-based precinct plus structure plans and PCP reform to trying to achieve some of these important objectives. Importantly, Brent was involved with the recent precinct structure plan review in Victoria, which is trying to provide metrics to create the 20-minute neighbourhood in Victoria. And I hope we've got, we're just waiting to see whether with Tim Williams, has he joined us? Tim Williams was to join us, and he may join us later, but he is from Grimshaw, an international consultancy for architecture. So without further ado, I'm going to welcome the panelists, and I'm going to ask them each a few questions and get them to respond to their response to the series. So Brent, first of all, one of the series recommendations of the series is that we strengthen our policy frameworks and use evidence to inform healthy and sustainable cities. Now, I know that the Victorian Planning Authority has recently released its new precinct structure plan guidelines, which you've been championing through the process, and this is all for new suburban development. First of all, are the guidelines mandatory, and what do you think, how do you think they will contribute to addressing some of the deficits that we've just identified for outcomes for Melbourne, particularly in outer suburban areas? And what can other jurisdictions learn from your experience in developing these new guidelines? So can I open up for you to respond?
Thanks so much, Billy, and thanks for inviting me today. Yeah, so the guidelines really set out measurable targets to support the achievement of our 20-minute neighbourhood policy, and overall these targets, they'll deliver more density in the right locations. They'll try to encourage more diverse housing typologies and drive a more compact neighbourhood centre, along with like a raft of other targets around tree canopy and the like. And I guess these are all very common and contemporary objectives, but these targets will now function as a published policy standard. And that's important because this is the kind of trigger that enables the step change in how we undertake strategic planning and then how the plans are responded to by industry. All of these targets are measurable, so our plans will, move to demonstrate the performance. Subdivisions, as I said, will also need to demonstrate performance against the targets. And, we're moving into a world where, I guess plans and data and systems are all digitised, testing is easier and quicker, and decisions are requiring very clear evidence and the use of clear policy. So already in our plans underway, they're proving very effective in, I guess, not only driving better outcomes, but also providing the evidence to support decision making. And I think that's been really valuable. So you asked us for the takeouts.
Yeah, I'm sort of curious to know about whether or not what can other jurisdictions learn from the process that you've gone through to develop these guidelines, which are a step change to the previous guidelines we've had for these new suburban developments.
Yeah, that's right. Look, we did a lot of testing for the targets. We really needed to, we were introducing measures around minimum densities and even like the structure of the kind of a densification and how it's kind of spread out through a new greenfield area. We needed to test the targets, and we also need a whole of system response. And even we're embarking on, further reviews to the development assessment system to ensure that the policy and the codes are aligned, and that also that industry is supported by, clear metrics when they go to respond to those policy measures. You'll need to, one thing we really found is we needed to drive change, even if it created conflict. And you were part of our expert panel. We've got really innovative, authorities and property developers in Victoria and Australia, but density was a very contentious topic amongst key stakeholders. And there's a lot more work that we need to do around, improving standards of built form design and coordinating land and infrastructure to deliver early services. But, all very, interesting problems to solve, Billy.
I think that's a good point about the fact that it's not just density for density's sake, because density to have amenity, and that's something that I think you've emphasised in your guidelines. I just want to pick up one of the recommendations is about biodiversity sensitive design. Has that been incorporated into the new guidelines?
As so far as we employ what we've got a sustainable subdivisions type approach, these PSPs are really kind of setting out the structure at a higher level, the public land and I guess the zoning. But yeah, it certainly includes measures to consider biodiversity, I guess high value trees, and design the place around these I guess interesting and unique settings. So we've definitely strengthened in that area. There's a lot more work though to be done around, I think, climate resilience and healthy neighbourhoods, and really designing metrics for those that sit not just in policy but through the whole life cycle of development.
Thank you very much, Brent. Gillian, one of the recommendations of the series in terms of our what next is that cities develop and expand our upstream determinants, indicators of upstream determinants of health and sustainability, the causes of the causes, if you like, of ill health. And that would be including indicators around city planning. We talk about the 11 Ds, but also some additional indicators that might sit very well in your bailiwick: tree canopy, traffic, heat-on effects, that sort of thing. Can you tell us about, as the Commissioner, how do you respond to these recommendations about and the potential for these to be included in state environment reports in the future?
Yeah, thanks, Billie, and hi everyone. Look, first of all, I just want to congratulate you all on doing the work. It's absolutely fantastic. And from where we sit, the way you've approached it, a very rigorous approach to indicator development, and the whole thought process sits completely consistent with how we work and do our work. For those who don't know of the work of the Commissioner, my role is an independent statutory role that reports and advises government on the health of the environment at a subnational level, so for the state of Victoria. So we don't work at the city level per se, we work at the subnational or state level, and we report on, for example, the state of the environment. But more recently, over the last few years, there's been progressive policy reform in keeping with the sort of work that Brent just talked about, where our legislation's been updated and expanded to report more at a precinct scale. So marine and coastal scale, or ecosystem scale, such as State of the Yarra and its parklands. So all of the work that you're talking about and that you're doing is not only completely consistent with how we go about doing our reports and making recommendations to government, but also starting to drill down then into more specific precinct, or, for example, here at city level, or even large regional city level indicators to help us elicit the best recommendations that we can make to government. So it's totally useful for us and will become a very important resource for us. Just a couple of other matters, Billie. So that, combined with our work that we're doing to operationalise the Sustainable Development Goals, again, taking our indicators, mapping them against the SDG framework, using that as a representation of the indivisible whole, if you like, provides a foundation of our work to sort of report on the causes of ill health. Two other things. One is your reference to spatial data and sense making from spatial data is completely consistent again with the work that we're doing. And right back to the 2018 report, we did make a recommendation around the Victorian government investing more in spatial data for this type of work. And we now, in our most recent report, which was the 2021 State of the Marine and Coastal Environment, included a full analysis on the sorts of capabilities we could be investing in for marine and coastal environment. If we translate that, there's a chapter on that. So anyone who wants to look at that sort of work, it's on our website, ces.vic.gov.au, but it looks at current, emerging and way into the future technologies, including Earth observation as a source, with machine learning, AI, etc. And so we're completely aligned with your thinking, Billie, and we're completely aligned with the work. We do quite a few indicators now that link to this. And just on air, in 2018, we reported 170 indicators across the whole of the state of the environment for Victoria. We're now preparing the 2023 State of the Environment report We've got 14 indicators for air, so nearly 10%, because we'll do repeat reporting. As you say, you need to track, report, see how the trends are going, moderate your policy frameworks. And quite a few of them relate to health, so health impacts of air pollution, health impacts of noise pollution, health impacts of pollen, etc. So yeah, we'll use your work, we'll build on your work, and we'll continue to look at how we can drill into the city level reporting.
We would love to see that. That would be a great outcome for our impact for us from this series. Thanks so much, Gillian. Now, Tony, you're the chair of Planetary Health at Monash, and for decades you've been banging this drum about on global issues of urbanisation, sustainable development, human health, and including the work that you've done at the World Health Organization. So, what's your response to the series? And I know you think we're a bit late to this, but but anyway, what's your response to the series, and also what's your thoughts on the priorities to transition to healthy and sustainable cities?
Yeah, look, I'd really like to congratulate you and the whole team as well, Billie, as our other colleagues on the panel have said. This is a really important series, and I wanted to start today with the words of Jan Gehl, who, as you would all know, a leading urban planner and from Denmark, and he's worked in both Melbourne and Sydney, of course. And one of Jan Gehl's books was Cities for People back in 2010, a beautiful book. I think what your series takes us a step further, Cities for People and Planet, bringing the planet in. As you mentioned, Billie, I was a member of the Lancet Planetary Health Commission. And in that context, our earth science colleagues have been arguing for some time, Will, Stefan and others, that we've entered a new geological epoch, the Anthropocene, the epoch of humanity, and most people live in cities. Earth scientists argue we've left the Holocene epoch, which was considered the Goldilocks epoch for human life on Earth, not too hot and not too cold. Here in Australia, recent weather extremes that you referred to, Billie, and others, our climate has changed. It's already affecting our health here and around the world. Those devastating bushfires in 2019-20. The ongoing flood crisis on the east coast of Australia, more flooding expected today and in the future along the east coast. We need to bring the planet into our urban decision making. And your series with your colleagues brings these co-benefits to life. Rethinking the way we feed, move, house, power, and connect the world in our cities. And I think this is a really important advance. And my final point at this stage is about transitions. What we're talking about here is urban change. And as you've highlighted, these transitions need to be fair. And we need spatial data, as Gillian said, because it's about spatial justice in our large cities. So we're striving for healthy, just and sustainable transitions in our cities, Melbourne, Sydney, across our country, around the world, Cities for People and Planet. So well done, Billie and colleagues.
Thank you so much, Tony. I hope we can live up to your great aspirations there, because I think we're very excited about the potential here. Before we finish, I just wonder if for each of you, you've got a one takeout message that you've got from the series and the sorts of things that Sydney and or Melbourne should be acting on if we're going to transition to healthy and sustainable cities. So Brent, what's your one takeout message for what we need to be doing in Melbourne?
I think, I guess the new metrics set, I guess, a new base case for us. I think they cover off on a lot of the, challenges that we're facing. But I think the biggest push will be around how we coordinate our government systems to deliver land and infrastructure. That's a key one for me, particularly for public transport services.
Yeah, what we've called is integration of horizontal integration across government. Yeah, it's a big one. Good luck. Gillian, how about you?
Oh, hi, Billie. Well, before I go on to my one thing, I just want to say, when I think about the disruption that the COVID pandemic has had, and what does that mean for cities, I do think we're more connected than ever to environments. And we know from the Marine and Coastal Environment report that we did for 2021, so the first 6 months of 2020, there was a 28% increase in people getting involved with coast care activities. Now, that was during the lockdowns in Victoria. So it's kind of interesting to say, did those people shift permanently or get involved permanently? But what do cities look like post the pandemic? But if I could do one thing, I would say that I think a State of Our Cities report, the sort of work we do, could be really helpful in helping to continue to create the evidence base and make recommendations so that we keep the momentum, so that things are cyclical, because we do 5-yearly reporting, so it's cyclical and picking things up. And it would be great to track progress against these sort of initiatives, make sure we have the right indicators, but also, if I can be a bit parochial being Victorian, make sure we're not just looking at Melbourne, but we're also looking at our regional centres and towns, because we do know there's been a shift. And I think, you know, Ballarat, Bendigo, Geelong, Latrobe City, etc., we need to be looking at them as well. But I would certainly be an advocate for a State of the Cities report for Victoria.
I think a great start to that would be the work of the Australian Urban Observatory, which has a lot of these indicators in it for the 21 cities in Australia, just to give that, the Australian Urban Observatory, a plug for those of you who are interested, but also plug it to you too, Gillian, because I think that's a great start. Tony, how about you? What's your one takeout message?
Yeah, no, thanks, Billy. One of the things that I think is important here, and Carl touched on it in his opening remarks, that when we look around the world, it's interesting to compare the Anglo-Saxon model cities here in Australia, New Zealand, United States, for example, with cities in other cultures. And I think, Carl, you pointed out that Sao Paulo, Lisbon, maybe Bern are examples of where there's a better access to public transport, for example. And so for me, this is a really important message about here in Australia being open to different ways of doing things in other cultures. Our urban development culture is Anglo-Saxon. We need to be open to other ways of doing things in the Francophone world, elsewhere around the world. We can learn from experience elsewhere. So that's the main point. My final little thing, Billy, I love the 11 Ds, and I was thinking your papers, your series is about 11 Ds to deliver SDG 11, which is, of course, the city's SDG. So I thought I'd stop there.
I wish I was.
Nice tagline, Tony.
I wish I'd been that clever to realise that, Tony, but well spotted. Very good. Okay, I'm going to hand over now to Klaus Gable, who's going to be doing taking questions and answers. So I'll hand over to Klaus to facilitate that discussion. So thanks so much, panel. That was tremendous.
Thanks, Billy. I hope you guys can hear me. We haven't received a lot of questions yet submitted by members of the audience. I'll start with one question, maybe to all the panelists. Change in cities takes time. So how do we make sure that good policies are developed and then implemented and maintained over the long term beyond election cycles? Tony.
Yeah, shall I jump in, Klaus? For me, this takes me back to Gillian's point about regional cities. And one of the big contests in Australian politics is between the big cities and the rest of the country. Whereas if we're careful to engage all of our urban centres across the country, many of them quite remote and regional across the country, then we can start to have national conversations. But while ever it's combative and polarised between the big capital cities and the rest of the country, we're in for problems. So Gillian's really important point about this being just as relevant to Ballarat and elsewhere in this state, but also other parts of the country.
Oh yes, can I add to that, Klaus?
Sure.
The other aspect is independent, regular independent statutory reporting. So in Australia, we have 2 jurisdictions, Victoria being one, the ACT being the other, who have an independent commission that reports on the health of the environment. Noting that the health of the environment is increasingly moving into socioeconomic factors and is being legislated in Victoria around that, including looking now at our 7 climate adaptation plans. So it's not just the biodiversity we're talking about the sustainability of our ecosystems at large and how people live and work within them. So having independent science reporting that looks at a systemic review of the policy frameworks and how they're performing, and then against agreed indicators that are co-designed in the way the team have here, we use that same co-design method with stakeholders to make sure we're reporting on the right indicators that a lot of people have agreed are the right indicators, and we're tracking them over time. And we table our results in the Parliament of Victoria. So for the 2018 State of the Environment report, we made 20 recommendations, 19 of which were accepted in full, part or principle. That then goes into the system, the departments and agencies who then start to take on some of those recommendations and work to them, and you get a virtuous cycle of continuous improvement. Like any industry, works with continuous improvement, monitor it, track it, change it, move on, sort of thing. So that's how our system works, but I think the independence of the Commissioner, in my view, is a critical element there and probably might get to the heart of the intent of the question.
Thanks, Gillian. I have a question for Brent. How do we transition our car-centric cities in established areas to 20-minute neighborhoods?
I think, a key review of the 20-minute neighbourhood concept is really centred around how we can transform some of our public places and, of course, densification. So in established areas, there's some work now being done looking at the streets, the street networks, opportunities for renewal, and, of course, then introducing those new I guess, and improved transport services, even, micro networks for, things like scooters and the like. Our focus really in the kind of new areas, those new greenfield settings, has really been about disrupting the structure. So we were getting a very common flat structure in town centre and a very common conventional housing typology. And so our disruption has been about introducing rules around densification to create that walkable, compact neighbourhood and the population to support those outcomes.
Thanks, Brent. I have a question for Gillian. How can we plan to put more priority into the green spaces to create healthy cities for people and the environment?
Well, thank you, Klaus. We have a really good example right now about not only how we can plan for it, but how we're doing it. In Victoria, if you go to the Water for Victoria Water Policy, Chapter 5, which is about resilient and livable cities, you'll see a whole chapter on integrated water management, which I have the honour of chairing one of the catchment integrated water management forums. And what we do is work together and plan together across boundaries of organisations for the betterment of the catchment. So this is about the community in the catchment and making sure that the money is diverted into the right livable green spaces and, climate adaptive outcomes for the community using water as the issue. So for this example, it's a very good example if anyone wants to look at it. We're 5 years into the development. It links in with the work Brent's doing with the VPA. But Victoria's come a long way down the path here to say we must learn how to govern beyond our boundaries as leaders in organisations, whether it's a water corp or a catchment management authority or a local government. It's actually the outcome for the community and the environment that matter. And we've got some great results now that have been published on the benefits of integrated water management and the appropriate governance to allow the implementation. So planning is one thing, but it's actually in the execution where things fall over, as Brent was talking about. And the great model that we've developed here is actually to do the co-design and set up the governance in an innovative way so everyone can work towards the greater outcome and still, you know, understand why we're going into that local government area and not that one, etc. So that's well underway across the whole of metropolitan Melbourne, which is 75% of Victoria's population. And there's actually case studies, so I'd be happy to share some case studies with you on that.
Thank you, Gillian. I have another question for Tony. One of the points that was made in our webinar was that we need to continue to make improvements in information and data sharing. And one of the audience members asks if the Pursuit program on mapping climate policy from the University of Melbourne will be part of that.
Oh, I must admit, I don't know what the Pursuit program is, but certainly I'm imagining that you will need to have climate information in this kind of work, and so that's downscaled, like local climate information, because in the work you're doing, you refer to heat as a risk to health, and this is increasingly important, not just here in Australia, but around the world. So we have our global climate models, but we need to be able to downscale them to this urban scale, so we can look in a more granular way at the risks to human health from extreme heat. And if that's what Pursuit's about, and if it's part, Billie, of this broader network of urban information that you have a key role in, then that sounds terrific. Yeah.
Thanks, Tony. I have a question for maybe Brent and Gillian. One of the audience members writes, biodiversity sensitive urban design is good. However, we need to be careful that this is not used as a way to offset destruction of intact natural habitat. Oh, now my screen just did a jump here. Which biodiversity sensitive urban design cannot replace for many species. Are there ways that we can address the issue of developer capture of the planning system? This relates to other urban planning issues as well.
It's a tricky one.
Yes, it is a tricky one. I don't know, Gillian, if you need to go, or even Tony is going to turn up.
I can speak to the work we do. I can't speak to some of the aspects of that question, but there's a lot of, so in Victoria, we have the Biodiversity 2037 plan. So it's a 20-year plan for biodiversity and policy, and there's a lot of effort now going into implementation. We're continuing to track our progress, and that includes everything from corridors and biolinks so that we can make sure that we have corridors for our threatened species. But there's no doubt that biodiversity decline is one of the big issues of our time, and we know that. In 2018, we tracked 35 indicators of biodiversity, 3/4 of which were in decline or status unknown across the state. So this is not an insignificant issue, and it's not confined to biodiversity, biodiversity in cities. But in terms of the broader question, I'm probably not experienced to discuss. I'm not in planning.
Klaus, I was just going to jump in and say I'm not currently employed in government, although I spent many years working in government. And I think it's pretty clear in Australia that our decision making around urban development has been corrupted by the undue influence and the political donations, particularly at the state level, and in some ways even more direct at the local government level in parts of the country. So that's why we need ICACs and these sorts of things to provide oversight of the decision making. And then once you've got those oversight mechanisms in place, then you need strategic plans for larger scale urban development. And I know there's been various attempts at this and it's sometimes undermined by the development lobby, frankly. And I know that I don't know whether Victoria and Melbourne still has an urban growth boundary, but that's one way of constraining the growth of a large urban area into peri-urban areas and protecting biodiversity. But importantly, I think it's about making room for nature inside the city. And that's why we need to address the car reliance, because cars and car parks and roads takes up so much room in a major metropolitan area. If we can moderate that, the amount of space we're using for the motor car in those various ways in cities, then we've got more room for nature, more room to grow things in cities, including growing food, of course, and cooling down the cities.
Okay, maybe one more question to Brent. In any construction project, my experience is landscape is not prioritized. We need to change this if we are to have a positive impact. What can we do to fast track this?
Yeah, look, I would agree. Traditionally, I think it in some areas it's been a miss, and even, you know, we're talking about biodiversity and even, you know, green spaces and parks. There's a much greater shift now on placemaking again, which is great. Not a new concept, but a good focus, attention. And so, you know, we've got levers in our guidelines. We do need to consider the landscape and landform more significantly in the kind of urban structure design, and we've got measures to do that. But many of these, you know, challenges we face, they all cascade from strong policy objectives, and we don't have those objectives in place, we don't have those settings in place, the focus can be too light on, for example. So I mean, I guess that would be the kind of key thing I would impress on, you know, policymakers with these challenges.
Thank you, Brent. I'm conscious of time. We started a few minutes later with the whole webinar. What do you think, Melanie, Billie? Should we take another question or?
No, I think we need to wrap up.
Okay, we need to wrap up with the Q&A. Thank you to our panelists and also to our audience members for submitting their questions. And now I would just like to hand over to Melanie Lowe for some concluding remarks.
Thanks very much, Klaus, and yeah, thanks again to our panelists who've provided some terrific and thought-provoking insights. So thank you to Gillian, Tony and Brent, and also thanks to our presenters and facilitators, Carl Higgs, Billie Giles-Corti and Klaus Giebel. And thanks very much to you, our audience, for attending and for your thoughtful participation and questions. So as we launch these findings, we invite you all to access and to use the indicators as well as the tools that we've developed for this series. And specifically, we invite you to join the 1,000 Cities Challenge via the Global Observatory of Healthy and Sustainable Cities, which you can see the link there on the slide. So together, we can use our free and open access tools to calculate healthy and sustainable city indicators for more cities across Australia and also globally. So healthysustainableCities.org. The Observatory also hosts the city reports, which we've discussed today, and also has a link to the Lancet Global Health series on urban design, transport and health. So we can encourage you to jump on there and to have a read. So thanks once again for your participation. We hope you have a great day.
Thank you. Thanks, everyone. Thanks, everyone. Really appreciate all your
Thank you.
input. So